kind of giving my introduction before. My name is Dr. Kim Harris, and I'm a naturopathic doctor out here in Presque Valley, just down the street. My partner and I, we both kind of focus on women's medicine, and we work with women of all ages, but mostly women who are entering into menopause and then after. So I do bioidentical hormones, I do acupuncture, botanical medicine, homeopathy. I do a lot of nutrition counseling. We do weight loss, and then also we're starting to kind of focus on some of this anti-aging treatments that are coming out, and there's a really exciting one that I'm going to talk to you guys about at the end. But I wanted to kind of focus today on how to prevent and treat the aging process, I guess you would say, using natural therapeutics for, kind of diet, exercise, lifestyle, that kind of stuff. So I was going to start by talking about what causes the aging process. Externally, I think everybody knows sun damage is one of the biggest factors for causing skin damage, and that's well publicized. Other things, environmental factors, just smoke in the air, smoking, that kind of stuff, that causes a lot of damage to the skin. But then also we've got a lot of chemicals and things in our environment, things that we put on our skin, things that we're exposed to just from traffic, and but then also from food. You've got chemicals and processed foods and that kind of stuff. So that can all lead to aging internally and externally. So when we think about aging, a lot of people just think about skin. I want my skin to be firmer, look better, not sag as much. But then we've also got internal damage from aging. One of the biggest ones is cardiovascular. So as we age, our blood vessels will kind of thicken up, and that causes the heart to have to pump harder, and that can lead to high blood pressure, which again, that also feeds into the loop of causing more damage to the heart and the blood vessels. So, things like exercise and taking fish oils and stuff, that can help with the aging process in the cardiovascular system. The other thing that happens, especially to women, is we lose our bone density over time, which has also been in the news for a long time, making sure you're taking your calcium, that kind of stuff. But it's very prevalent. That's why we have women do their DEXA scan every 5 years, because osteoporosis is such a big factor in our healthcare system. But there's a lot that we can do to treat that as well naturally. Who here experiences memory loss as they get older? I know that I definitely have. There was a recent study done, and they were talking about how they believe that memory loss, more than even loss of blood flow to the area, is your brain is literally filling up with memories over your lifetime. So as we get older, we have so much that we've done, and your brain is just getting too full for you to remember those little details from day to day. So I thought that was interesting. It's maybe a more positive way to look at memory loss. I've done so much over my life.
It sounds like a good excuse.
I think so too. You can tell that to people anyway. Those studies come out all the time, and who knows? It'll be proved wrong in a year, but then you also can have lack of blood flow as well to the brain. So keeping your cardiovascular system intact and functioning well over the years will also help improve memory. We've also got vision changes. People tend to get, all kinds of problems with your eyes, macular degeneration, blurred vision. You need to get glasses over time. And then, of course, the skin changes that everyone is concerned about. So what happens is you actually lose elastin in the skin, and that leads to, the kind of sagging look. Then we also have those environmental stresses that I talked about, and poor food choices, all that kind of stuff. And what it is oxidation, and that's what skin damage is. It's oxidative damage to the skin. So that's why when you hear about these antioxidant foods, it's combating that oxidation that you get from the environment and from food. Your epidermis, the top layer of your skin, also thins out, and so that leads to that kind of the more pale look, and you can see blood vessels that are closer to the surface. The other problem that creates is easy bruising. You know, your vascular system becomes a little more frail. So if you just, you know, do a bump that wouldn't have done anything years before, you've got these fragile blood vessels, and then your skin is thinner, so it leads to more bruising. And then the other thing that happens as we age is we get more growths on the skin. You can get more skin tags, moles, and then also seborrheic keratosis, which is mostly in the sun-exposed area, and it's kind of that like brown-looking growth on the skin. It's described as like a greasy kind of stuck-on appearance. They're really common, but those are fairly easy to take off. Skin tags, moles, and the seborrheic keratosis, those are fairly easy to remove in office. So as far as prevention goes, you know, I like to focus a lot with my patients on eating well. That's the basis for everything. You know, if you're not eating well, you're not going to feel well. You're probably not going to look that well over time. So you need to eat a lot of antioxidant foods, which are the foods with a lot of color in them. The best foods to eat are like green leafy vegetables, kale, broccoli, spinach, but then also like dark-skinned berries, blueberries, blackberries, that kind of stuff. Those have a lot of antioxidants in it, and those will actually combat any oxidative damage that's done from the environment. It's important to eat a wide variety of food. So, you know, make sure you're not eating any processed food would be ideal, but of course, you know, we all eat some. But mostly fresh food is really the way that you should be eating. Lots of different colored vegetables, orange from your carrots and bell peppers, greens we talked about, blues, and then, you know, any foods that put stress on your body, like processed foods, but also sugar is a huge stressor, and that can, I mean, that just wreaks havoc all over your body. So it's important to, you know, reduce the sugar in our diet. The other thing that's really important, especially here in the desert, is hydrating well. So the rule of thumb for drinking, if you're not exercising or exercising really lightly, is to drink half your body weight in ounces per day. So that can be quite a bit for some people, more than the 8-ounce glasses of water that a lot of people recommend. So that would be if you're about 120 pounds. So just make sure you're getting enough water throughout the day. That will definitely help the appearance of your skin. And then the other thing, exercise. That'll help with the cardiovascular system. That'll help, you know, keep your heart functioning properly. It'll keep your blood pressure down. And then if you do weight-bearing exercises, that will help prevent and treat osteoporosis. So even body weight exercises can be really great for preventing osteoporosis. And I like to tell this to all my patients. There was a study done on osteoporosis and bone loss in the hip, and they had patients, just when they were standing at the sink doing dishes, they would stand on one leg, and that, over the time that you're doing dishes, if you switch off, was enough to prevent bone loss. It was, I know, just that small amount. It's not even exercise. You're just standing on one leg. So I think that's really cool to tell people.
For how long should you do that?
You know, probably about 10 minutes a day would be great. And just make sure, you know, that if your balance isn't great, that you're holding on to something. And then for the brain, to kind of help and prevent the aging process there, just make sure you're staying active socially. So you go out and see friends, you're part of a group, you can do crossword puzzles and that kind of stuff, but the more active you are with your brain and engaging with other people, the better your memory is going to be. There's also a lot of herbs that are really good for memory loss, and I always recommend either, so coconut oil is a really good one, a tablespoon a day if you're having memory loss, and that has medium chain triglycerides in it, which are some of the only fats that will by themselves cross the blood-brain barrier. So they're a direct source of energy for the brain. You can also get, they're called MCTs, which is what's in coconut oil, MCT by itself, and you can take that, but you just have to watch out for a little digestive upset if you take too much. So you want to start slow, but even just adding coconut oil into your daily regimen can be great. You can put it into a smoothie and eat it that way. But yeah, coconut oil is wonderful for that. And then the other thing is turmeric. There are lower rates of Alzheimer's disease in countries where they use a lot of turmeric, like in India where they use it in curry, so they started doing studies on it. And they've actually found that turmeric is one of the only things that can treat early onset Alzheimer's. There are no other drugs for that. So adding it into your cooking, and then you can also take it as a supplement as well in capsules. You kind of have to take a high dose, but so those are what I would recommend for, the kind of loss of mental function that I'm pretty sure most women experience. And then I also wanted to recommend some supplements for you. We learn a lot in school about how to analyze supplementation to make sure that it's the correct form of the vitamins and nutrients. So there, I put some down at the bottom of your handout. Well, kind of in the middle, actually. There's 3 that are, this is what I would ideally put all women on. The polyphenol nutrients is a multivitamin, but it also has a lot of antioxidants in it. So, it's really difficult to get the correct amount of antioxidants in your diet unless you're just eating dark skin berries and, great vegetables all the time. So supplementation can be really helpful with that. So the polyphenol nutrients is a great high quality physician only product. And then the OsteoForce is what I recommend to patients for preventing and treating osteoporosis. If you're just taking a calcium supplement, that is not enough by itself to increase the bone structure. You need calcium, magnesium, vitamin D, vitamin K at the very least, and this has a lot of extra stuff in it too. There's been some studies that have come out lately saying, calcium, if you take calcium, it increases your risk for cardiovascular disease, and that's because we're not taking the right forms of it. We're not taking the other nutrients that are necessary to actually get it into the bone. So that's a great product right there, the OsteoForce. And then the last one is an herbal product. It's called Defy, and it is a mix of, they're called adaptogenic herbs, and they work on the adrenal glands. So as we age, our adrenal glands kind of tend to get a little weak, and these herbs will help just kind of strengthen those, and they'll give you increased energy throughout the day. But it also has reishi mushroom in it, and that has several studies behind it that show that it actually does decrease the effects of aging. So it's a really strong antioxidant, and when they used it in rats, there were less effects of aging throughout the body. So it created all these great antioxidant effects all throughout the bodies of the rats. So that's why I like that product, because it will increase your energy, and it also has the mushroom mixture in it. The mushroom is called Ganoderma lucidum, so if you're looking for a product that has the mushrooms in it, that's the specific type. The other nutrient that comes up in quite a few studies is resveratrol, which you've probably heard of it. I think, like Dr. Oz talks about it, it's kind of this miracle thing. It's found in grapes, so they were kind of saying, you can drink, all the red wine that you want, which is not necessarily true. But it is just found in grape skin, so that also will help. They found that it decreased damage to the skin and increased antioxidant status in the body. So those are just a few ideas of things that you might want to look for in your foods and your supplementation that can really help fight the aging process. So then as far as treatment goes, because by the time most of us are in our mid-20s, we've already got skin damage from sun and environment and food and all that kind of stuff. One thing, Marge is going to talk after I'm done about some products that have good antioxidants. Serums are really great for preventing and treating aging. But the other thing that we've just started doing in our office is called Platelet-Rich Plasma Facial. And it's kind of blowing up. Like, people use it for all kinds of things. Now they're using it. It decreases wound healing time, so they're using it after surgery. They're using it for people who are going bald, using it in the scalp. Has anybody ever heard of the O shot? No. It's a shot that's done for women who have sexual dysfunction. So if you're having, painful intercourse or, any kind of sexual dysfunction, they're using the O shot. And so that's this PRP treatment as well. And what it is actually they do a blood draw, and then you spin it down like in a centrifuge, just like they do with regular blood samples, and it separates out just the platelets at the top. And platelets are kind of powerhouses in blood. They attract growth factors and stem cells. So that's why it's so great in, wound healing and all that kind of stuff. But now they're finding some kind of cosmetic benefits to it as well. So the way that we're using it is it's used as an injection, and then you can also use it in a facial form as well, where it's kind of, it's called microneedling, and it's kind of put into the skin. And this is one way that you can treat those fine lines and wrinkles that really not much else is going to take care of. Any kind of the like Botox and that kind of stuff, it doesn't really take care of lines throughout the face. The fillers will a little bit, but then you also risk having a reaction to those kinds of treatments. This PRP is only from your own blood, so the risk of you having any kind of reaction to it is extremely, extremely low. So I put out a flyer on there. It's kind of racy, but that's how they market their products. And so I just wanted to kind of tell you a little bit about it, because we're really excited about it. We wanted to give women a more natural way to look younger and treat wrinkles and fine lines. So that's why we're offering it in the office. Has anybody ever heard of prolotherapy? No? It's the same idea. You're spinning down and getting the platelets, but it's done in the joint space. So if you're having elbow pain, if you're having any kind of hip or back pain, any kind of knee pain, the platelet-rich plasma is injected directly into the joint space, and it causes a healing reaction. So if you've got kind of a long-standing injury, then this PRP treatment can be helpful for that as well. And actually, Dr. Hamilton does that. They did a couple of studies on, on the PRP facials. I can show you some before and after pictures, but they did it with a placebo, and they found, much better results with the PRP over 3 to 4 treatments, which are usually done 4 to 6 weeks apart. And patients just had a great reduction in fine lines around the mouth, around the eyes, and it can also be done on the chest as well, so that's a common place for skin damage to be done. So I'm just going to show you a couple of before and after pictures.
I'm sorry, you said 3 to 4 treatments, how many weeks apart?
4 to 6 weeks apart.
4 to 6, okay.
Yeah, and it depends on, your skin type and what's going on, but that's a pretty typical. And so, a lot of problems that women have with their skin is that it's just they don't have that even skin tone. It could even help with acne. So if you know anybody that's having trouble with acne, usually, it's younger girls, but it's a good way to treat acne without having to use any of those fairly toxic medications. So this one is pretty amazing. You can see, not only is your skin tone better, but some of the wrinkles are gone. They were telling me when I was talking to the trainer for this, she was telling me that there's a pillow that you can get because women sleep on their side, and so that's why you get that wrinkle there. And I guess there's some kind of pillow, or maybe it's like a foam thing or something that you put in the middle, and it holds you back like this so you don't get that wrinkle. I thought that was kind of funny. You guys see it back? So, anyway, oh yeah, here's some of the lines around the face.
So how is it put on the face when you get a facial? You put it
So,
injected in needles?
yeah, there's a couple of ways. You can get it injected, and when it's injected, it acts kind of like a filler. So you'll have some plumping of the skin around here and around here, but over time, it's more of a repairing treatment, not a filler treatment. And then to have the skin, like to even out the skin and to get rid of the fine wrinkles, it's called microneedling. And what you do is you put the PRP just on top of the skin, and then there's this tool that's got little needles in it, and it just barely scrapes the surface of the skin, so it allows the serum, the platelet-rich plasma, or you can use different things in it to get under the skin, and that actually causes some healing.
Which one is used in your practice?
We do both.
Oh, good.
Yeah. So it's a combination treatment is the best way to use it, because then you have it inside, and then you also have the external treatment as well. And I had the microneedling done. It sounds like it would be super painful, and it's actually not that bad. You can, we have some numbing cream that you put on, and that's about 20 minutes before the treatment. And it's more, it's kind of like irritating. And you just do the whole face, or if you're only interested in a specific area, you can have that done. So you've got, lines under here or on the mouth or whatever. That PRP is really great for that. So they're just using it for all kinds of things, so we really wanted to bring it. I think there's only one other doctor in Prescott that's doing it, but it's really kind of becoming really popular. They've talked about it on Dr. Oz. They talked about that O shot that I was talking about. So yeah.
And how often do you need to do it? Let's say you do your 3 to 4 treatments. Then
That should be it for years. I think if you get the series of treatments done, then that's gonna do you for quite a while. I don't know exactly how long, and it depends from patient to patient.
But it is yours. It's not like you have to get it again. I don't know.
It should be.
What does it cost about?
It depends on what you're having done. If it's just the injections, it's $4.95 a treatment, and then we're offering 10% off right now because we're kind of starting it off. And then the microneedling is a little more expensive because it takes about an hour. So if you add that in, it adds on a little more. But it's pretty great and non-toxic, so it's cool.